Thank you for agreeing to do this for us. Do you want to start by talking a little bit about yourself and your experiences of audiology? Just for anyone watching, they may hear a dog barking in the background, and also my housemates putting boxes in the attic. But this is the world we live in today. So yeah, do you want to go ahead and tell us a bit about yourself?
Sure. So my name is Bhavisha. I am an audiologist. I qualified to be an audiologist in 2012 after doing the degree. I went straight into NHS practice from my Band 5 routine adult audiology job, and that was really my first step into working life, but also seeing patients on a regular basis. And I knew that it was something that I really enjoyed. Particularly surprising, as you know, before doing my audiology training, I had no idea what audiology was. So, which again is quite common amongst audiologists. I spent a year and a half in that role. I quickly realized that I had a specific interest in pediatric audiology. So I then applied for my next position to become a pediatric audiologist, again within the NHS. I was successful and I started at a wonderful NHS trust in pediatrics, and that was a great learning curve, learning really amazing new skills. After I think about a year, I started my master's in advanced audiology at UCL, and I took the pediatric modules. I specifically enjoyed my research project, and my supervisor at the time was very keen for me to try and think about furthering my research life, even though that was something I never thought I would be able to do ever. And after my master's, actually, I ended up quitting my job and moving to Zambia to volunteer with Sound Seekers, which is a charity, 60-year-old charity that helped to develop audiology services all over Africa. And the specific job for that project was to spend a year in Zambia in the largest tertiary hospital to set up the first pediatric audiology clinic. When I came back, I started my PhD at UCL, and I am now in the third and final year of my PhD. I am still working with Sound Seekers, now known as Deaf Kids International, so still looking at training audiology professionals in all over the world, really. So I have a specific interest also in teaching.
Can you think of a specific experience today that you want to narrate that has really shaped your communication today? It could be an experience that occurred inside or outside of the clinical setting, but really just one experience of one interesting communication experience, good or bad, how you felt at the time, and what you might have learned from that experience.
I'm going to trick you by giving you two, but they're all the same experience. My experience happened in Zambia.
You are cheating.
I'm not cheating. I'm not cheating. It's all the same experience, promise. So yeah, in Zambia, when I arrived, there was very little in terms of ear and hearing care provision, and medical doctors, nurses, generally medical professionals they didn't know what audiology was, or the profile of audiology, it wasn't prioritized in any way. And so one of the things I had to learn to do was to collect evidence and present evidence to the senior medical staff, which led me to directly presenting evidence to the Minister of Health in Zambia. And I landed on his doorstep with a folder of evidence, and I was hoping that he might be interested in this otherwise unknown profession called audiology. And my persistence levels, I am still very surprised at, because I went back every week for months to talk about audiology. And I think that he could see how much I enjoyed my job. But also I had to communicate in a way that, first of all, to show how important ear and hearing care services were and the consequence of not having such services, and give specific examples of a success story, in a way, of somebody being able to access services and get the correct intervention management to ensure that that person had access to communication methods that they wouldn't otherwise have access to. So my first part of that experience was definitely communicating with the senior medical staff and the Minister of Health for that. And secondly was because I presented a specific patient story to the minister, a patient that I had seen as a 3-year-old at the time, a little girl who had severe hearing loss, and they came from a really small rural village, and they traveled a long time to get to our clinic in Lusaka, Zambia. And it was very quickly known that actually, yes, she did have a hearing loss. We tested her, it was very reliable results. But when I explained it to the mother, she was really shocked. The only reason she came into the clinic was because the child had a speech delay. And so she just thought she could get some help with the child learning some speech. And obviously, I told her actually it was to do with her hearing, and that's why she was late in talking. The experience then of being able to explain results to this mother who had no idea that this could have been an issue, could have been the reason why she wasn't talking, to understand and to learn about and ask questions about the cultural traditional beliefs of some aspects of medical care, and the fact that the mother genuinely thought that there was some curse or some other what is it called, some other experiences spiritually that was causing this child to have hearing loss. Just listening to her talk about that and having other nurses, because again, they were speaking a different language to me, so this was coming through interpretation. It just made me have to sit back and listen to a really heartfelt message coming from the mother. And ultimately, I knew that this was not going to be something to be solved in one day. I had to really put my management plan to a side, because I wasn't just going to get hearing aids out and start fitting hearing aids, because I knew that if I did that, they were not going to be used. It really had to be a communication journey between me, the mother, other members of the family, to understand the underlying issues, to see whether we could progress and see whether she would come back for a hearing aid. And yeah, it took weeks. It took weeks and months, and I learned from her and she learned from me bits about her culture, and she learned more about hearing difficulties, communication. And this child, she just really lit up the room. This child had so much potential. She was so animated. I've written blogs about her. I made videos about her, because I think from that moment totally changed the way that I practiced, totally changed the way that I communicated with the child plus family members and others involved, to try and understand a bit more about the complexities of certain situations in family life and culture that are associated with hearing loss, because those stigmas, you can't overcome them in one day.
As audiologists, we're very much focused on delivering an intervention, right? And we have our agendas, which are ultimately theoretically patient-centered or person-centered, but they are very much based on our backgrounds and our cultural context, and our cultural context typically being very science-oriented and evidence-based. And then you presented with someone who thought that, or who felt that their child's experiences were the result of some alternative explanation. How did you react, and how did you handle that? And what do you think it is that made that made the mum feel ready for her child to start wearing hearing aids and to be so involved in her care, do you think?
My initial reaction was, well, I was very surprised, because I'm an audiologist trained and everything in the UK, NHS predominantly, worked in the private sector, but my experiences of culture are those cultures that are within the UK system. And so turning up in a different country, I always knew it would be challenging. However, there were certain challenges that I didn't expect as such, this being one of them. So I was very surprised. Initially, yes, I did have my tick boxes of what I wanted to do. I needed to ask the history, I needed to do this, needed to get the audiogram. And then, yes, the next step would have been an intervention, a hearing aid fitting. And so I could have very easily just said, yeah, we'll book you in for that. But I could see the hesitation, and me being an outsider to the country, and also the language barrier, I, at the first instance, didn't get the full story from the mother, even though it was coming through somebody to interpret. I could tell somehow that she was holding some information back. And when I said to her through the interpreter that hearing aids would be helpful to this child, I could see it wasn't, I don't know how to explain it, but it was a facial expression that you could just see that this was not something she was happy with. And only then at that moment I paused, put my notes down to say, okay, let's see what we could talk about, and maybe she can be a bit more forthcoming about how she's feeling. The child was happily playing in the room, and of course it's all about the child, but in this moment it's the mother that's going to make the decision. So I had to really ask her to tell me about her experiences, and she wasn't so confident telling me. I think that there is always that difference in countries that have low resources. When someone from a different country, or a Western country, comes along, they often do try and agree with you a lot of the time. And so she wasn't coming forward with all the information, and only when I got someone else, another nurse who was from her specific village area, to talk to her mother to mother. I don't have children. Maybe, there was something that this mother could tell this other mother. I also don't come from that village. I don't come from that country. So she needed somebody to relate to. And as soon as that happened, I'm not saying that that's always going to be possible, of course, but as soon as that happened, a few barriers came down, and that really helped. But again, I knew it wasn't going to happen overnight. You can't fix. I'm not going to fix the traditional beliefs of this issue. It was just more about hearing about it, and perhaps over weeks giving her an alternative viewpoint, and coming back to the child to say how much potential she had, and to explain to the mum that she could maximize the child's potential by doing something, and she agreed to do that after some months.